joints. A joint basically is an area where two bones get together. So then the first type of joints that we have are the bony joints. In this case, you have two bones or three bones, and they get together, and then eventually they fuse and they form one bone. Example of this is the os coxae or the hip bone. This is the ilium, ischium, and pubis. So then when we are developing inside mouse uterus, we have these three bones. Eventually these three bones fuse and you get only one bone. This is another joint. In this case, the bones are connected with fibers. There are three main kinds. In this case, suture. Another kind is kyphosis and syndesmosis. The suture is connected with fibers, you can see here. Example of kyphosis is your teeth. They are joined to the bone, right, by these fibers. They don't move. They are not supposed to move. And syndesmosis, this one has a lot of bit of movement, but you see here the connection between the two bones. So let's take a look at the ones that we join with cartilage. This is the connection between the ribs and the sternum. That's cartilage. And between the pubis, you have a cartilage. This is called the pubic symphysis. So the next topic is going to be synovial joints, which are the ones that move a lot. They are actually called diarthrosis. The joints that don't move, they are called synarthrosis. If they move just a little bit, ampharthrosis. The knee joint, you have the bone, you have the cartilage right here, which is called meniscus. This is covered with a capsule, and inside the capsule you have the fluid. Right here you have the ligaments. That's the anterior cruciate ligament. You also have posterior cruciate ligament. What type of synovial joints we have? Ball and socket, pivot joint, saddle, hinge, plane joint, condylar joint. And what do you achieve with these joints? Different types of movements. So what type of movements we can have? Flexion, extension, abduction and adduction. Abduction is away from your body. Adduction is towards your body. You have also elevation, depression,